Hi everyone, my name's Jules Tushausen. I'm a speech pathologist of 17 years. The question was around what is speech therapy and what is occupational therapy and what is the difference. This is going to be really basic answers. You could chat GBT that to get a more detailed response, but basically speech therapy focuses on the assessment and diagnosis of speech and communication skills. We do this related to a child's age. So it's standardized. What that means is it's compared to hundreds and hundreds of other children of their age. We also use milestones to determine how a child is developing for their age, if it's considered like appropriate or on track for their skills. These skills refer to understanding, okay, like pointing, like that's where their understanding and knowledge of language. So when we're looking at that, we're not looking specifically at their talking. It might be pointing things like point to the dog, point to your nose, show me these three things, show me how to get dressed, like show me how you make lunch. So are they understanding the question? Are they understanding the vocabulary? Do they have that language and able to follow instructions and generally understand what's being said? The other side is the talking. So this will be things where we'll ask them, what is this? Tell me how you brush your teeth. Tell me a story. Finish the rest of this sentence. Copy this sentence. It's looking at their use of words in sentences, use of vocabulary, their auditory memory, and also their speech sounds. So if a child is talking quite a lot, but their clarity is quite low, meaning people aren't always understanding them, and they're of an age, like typically at 5, you should be understood, say 95% of the time to your teacher or to other adults. So when we're looking at those speech sounds, we're seeing, are they there for their age? So by the time a child's 6, they should pretty much have all of their speech sounds except the interdental, so they'll be saying teeth or birthday, and all their other sounds should be pretty clear, including their blends like splash, spider, fly. And so we're overall looking at communication when it comes to speech and language, and their play skills as well. So social, emotional, play, interacting with others. Okay, so children who are autistic or developmentally delayed may play differently. They may understand things differently in social situations and may relate or play in ways that look different to, say, neurotypical children. And when it comes to occupational therapy, what they're looking at there, especially for children, is how their body and their minds, how they're engaging with their environment. How calm and regulated are they? Or is there something that is stopping the child from attending or concentrating or joining in? Do they have some balance, coordination difficulties? Are they able to hold a pencil or hold something to play with that game effectively? Their gross motor skills needing some support? Do they have some difficulties kicking a ball or understanding where their body is in space, right? If they're walking in a straight line, do they understand where their arms and body is, or do they, have some balance difficulties or aren't as familiar with those things? It can also look at sensory regulation. So are they perceiving or receiving sensory things like touch or smell, taste, noise? Are they getting that input and analyzing and processing that well to interact and engage comfortably? Or are they getting a bit overstimulated, overwhelmed? Do they need some help coordinating those things and calming those sensory perception input when they receive those signals, whether it be a loud noise? Is that kind of causing what is known as a traffic jam in their brain? Is it causing a lot of overwhelm? All of our sensory processing, all of our sensory elements, there's 8 of them, they're interconnected, they're wired in with our nervous system, and one will inevitably affect the others or all of them. So it's really important to have a deeper understanding and to see an occupational therapist if you feel like your child has some difficulties with sensory processing, maybe getting overwhelmed with touch or sound or taste, and having a functional but very play-based approach to that will help a child. And it also helps the parent make accommodations and adaptations that are needed. It breaks down barriers of a child being naughty or, that stigma or myth that if a child would just concentrate better, everything would be okay. It really helps parents and teachers understand that children are always doing the best in any situation that they're in, and that overwhelm is not a choice, and having meltdowns is not a choice that anyone would choose. And make accommodations that help that child participate more, engage better, and feel supported and confident within themselves. So basically, if you put it down to a couple of sentences, speech pathology is about communication, expressing yourself, understanding, learning different things and different modalities. So they might be using AAC, they may be using keyword sign to express things, and express themselves. And occupational therapy is about movement, control, how they use their body and how they interpret their world around them, how to help support them in ways, if needed, to participate and learn. So they're both evolving over time, and over the last 17 years, I've seen huge changes in both areas. The most notable being the acknowledgement of play and child's safety and child's well-being and mental, psychological safety, knowing that they're not forced to do things. We don't want to, grow a child by forcing them, because we're actually putting a bit of trauma there and not, helping them in the way that their brain needs to develop. That's going to be helpful for them in the long run as well. Okay, everything takes time, and we need to do it the right way, in a neuroaffirming way, in a way that follows the child's lead and their interests and their comfort level, their support. They're different to adults. They rely on adults and their carers and parents for their psychological safety, for their overall development, for their sense and development of self. So when we see them having difficulties, we don't want to force them to change. We want to support them where they're at to help them grow to their potential. And that comes with a lot of education for parents and adults and those around that child. So hopefully that's answered that. And if you have any other questions, check out ChatGPT, and that can also give you a lot of information.